Hi everyone, it's Neil here, also known as the Wax Whisperer. Thank you for tuning in to my latest video. For anyone who doesn't know who I am, I'm a UK-based award-winning consultant, audiologist and clinical ear care specialist. The client in today's procedure had bilateral occluding earwax. We started off with his right ear. Um, there may be a bit of a lag in the video, I do apologise, it's an issue with the upload. So here we have his right ear, and the earwax is a very soft and sticky consistency. Um, he did advise me that he was using hydrogen peroxide drops, and I have noticed, it's just anecdotal evidence really through my own observations and experience, but hydrogen peroxide drops, it does turn the wax into almost a mushy consistency, and it can be very difficult to vacuum. The reason for that is that that consistency of wax can quite easily block the suction probe. You probably see me there just trying to wriggle the suction probe because it was slightly blocked. Whenever I perform suction, I always advise clients to use olive oil drops. I find olive oil drops binds the wax together. So when you do suction it, it comes out in larger chunks. You get a better grip. If someone suffers from keratosis obturans or has a lot of dead keratin, dead skin in the ear, then I typically do instead, alternatively, advise to use sodium bicarbonate earwax drops. I find sodium bicarbonate drops works much better than both hydrogen peroxide drops and olive oil drops compared to, as I said, to sodium bicarb drops. So what I'm doing here now, because of the consistency, I'm just using a Jobson horn to scoop out the lateral part of the wax, which is the wax near the entrance. I managed to get clear kind of the outer third of the ear canal. Couldn't really go any more with the Jobson horn because the wax was a bit deeper. I was having to make contact with the canal wall, and it was just not possible to scoop that out without causing a bit of pain or discomfort to the client. So I've decided now to instill some olive oil drops myself to change the consistency of that earwax, and you can see the oil in there, it has changed the consistency. And I've resorted back to the Zollner suction probe, and I'm on the anterior lateral canal wall. So the anterior means the front part of the ear canal and lateral means near the entrance, and I'm just gently peeling away a layer of dead skin. You can see that skin attached to the wax off the canal wall. I'm now approaching the roof, so the superior part of the ear canal, and you'll see in a moment this wax, because of the olive oil, it's binded this wax together. You can almost compare olive oil drops to some egg in a cake mixture, whether it's a fish cake, potato cake. The egg binds that mixture together, it makes it firmer and more solid, and similarly I do find olive oil has the same effect with earwax. And as you can see, I've managed to get a huge piece of wax out there. This piece of wax was actually so large it didn't come through the ear canal at the same time. It was larger than the entrance of the ear canal. The ear anatomy is a bit unique, so at different parts of the ear canal it narrows, widens, protrudes, which can make it a bit more difficult because quite often you're removing larger pieces of earwax through a narrow orifice. So I've cleared the ear canal, there's a bit of dead skin, soft wax at the base. I'm just gently hovering over that, not making contact with the ear canal because that part of the ear canal is very sensitive, it's literally skin on bone. Whereas the outer part of the ear canal, it's cartilage and some fatty, fleshy tissue, so it kind of has a buffer effect. Just mopping up the entrance, and here you can see the eardrum, and now anteriorly and superiorly to the top right, the top east, if you're looking at a compass, you can see there's a bit of bruising, a bit of inflammation. I did a pressure test called tympanometry just to ensure the client wasn't suffering from what we call glue ear or acute otitis media, which is a buildup of fluid behind the eardrum, because that can cause inflammation, it can cause a bulge. But his tympanometry results, he came back with what we call a type A tympanogram, which suggests normal middle ear function, which you wouldn't have if the client had fluid, infected fluid, glue ear behind the eardrum. His symptoms were alleviated, he wasn't experiencing any pain. He reports using a cotton bud, and that's what's caused that trauma because he did go quite deep. So we've just asked him to monitor that, and we've just written a letter to his GP just to kind of make the GP aware of the condition of the right eardrum. And if the client does experience any pain, he will obviously resort make an appointment with the doctor. Sometimes you can get a glomus tumour, which has come as a pulsatile inflammation at the base of the middle ear, and that can cause inflammation. But that bulge is typically at the base, the floor of the middle ear, so you wouldn't really see that in that part of the eardrum. So we now have the client's left ear. You were seeing before, the wax is a completely different consistency. It's very dry here and quite sticky with loads of skin adhesions. And the client's also got a bit of otitis externa. So otitis externa is an umbrella term to define an outer ear infection. You can get superficial otitis externa, which is just a bit of dry skin, which is what this client's got, and you can get deep acute otitis externa, where you then get visible swelling of the ear canal, pain and discharge. So discharge in terms of ear, we call that otter ear, so you can call that discharge or ear pus, but the technical name when it relates to the ear is otter ear. So I managed to remove the big chunk with an ear hook. The suction probe wasn't really getting the grip. Momentarily I did go back with the suction probe to try and release this last piece of wax. If you've been watching a lot of my videos, when the wax is deep, I always try and use a suction probe, because you're less likely to make contact with the ear canal, with that part of the ear canal being sensitive. But that suction probe wasn't really getting a suction grip, so I had to delicately go in back with the ear hook, and I released the wax. You probably saw that on the posterior canal wall, which is the back part of the ear canal. I gently lifted it off the canal wall, removed all the skin adhesions, so elevated it, managed to remove the big chunk of wax. There's a remaining piece of wax stuck on the eardrum, so I've just gone back in with the suction probe, removed that, and you'll see in a moment I'm just mopping up a bit of dry skin, a bit of dry earwax that's just coating the ear canal. That's really quite insignificant. It's not going to improve the client's symptoms. A bit of wax is also good for the ear. It has antibacterial properties. It provides lubrication for the dry skin that coats the ear canal. And because it's quite sticky, any foreign particles that enter the ear can stick to the wax, and as the wax naturally migrates, well, in most cases it will expel any of these foreign particles off. Another evolutionary trait of earwax is it's quite acidic, so it's designed to repel insects from entering the ear. And in a moment we'll visualize the eardrum, and you'll see just where the umbo is. Now you'll see where the eardrum is, you've got the hammer bone, what we call the malleus, and in the middle of the eardrum, that part of the hammer bone is called the umbo. And just below that you'll see a thinning of the eardrum. And that thinning is a heel perforation, but in this case the client actually had grommets. So grommets are ventilation tubes designed to allow air to enter the middle ear via the outer ear, as opposed to the eustachian tube, which is a narrow tube that connects the middle ear to the back of the nose and the nasopharynx. And quite often when that eustachian tube gets blocked, there's no air being ventilated behind the middle ear when it should be full of air, which creates a vacuum effect, so that eardrum gets sucked in, and we call that eustachian tube dysfunction. And that tube is also a drain pipe, so any fluid that accumulates behind the eardrum, it can drain out of the eustachian tube. However, if that eustachian tube becomes blocked, there's no air there, the eardrum gets sucked in, and you can get fluid formation. So the client did mention as a child he had a grommet, so his eustachian tube was blocked, there was excessive fluid behind the eardrum, there was no air being able to pass up the eustachian tube into the middle ear. So what the ENT surgeons did, they pierced a little hole in his eardrum, suctioned out all that infected fluid, what we call glue ear or acute otitis media, and then fitted a rubber silicone type ventilation tube, which we call a grommet, which allows then air to enter the middle ear via the outer ear canal. I did tympanometry on his left ear, and we did diagnose actually he still has eustachian tube dysfunction, so I provided him with some advice and some nasal decongestion sprays he can use, and also the Otovent nasal balloon. And if he's still symptomatic after 7 days use, he's been instructed to visit his GP, who may be able to prescribe another type of prescription nasal decongestion spray, and if it continues to be symptomatic, they will have to make another referral back to ENT. I hope you enjoyed that video. Sorry, the commentary went beyond the procedure itself. I just felt it was a good opportunity to talk about the ear anatomy and some of the conditions and treatments that are available. If this is the first time you've watched one of my videos, I do thank you. If you've enjoyed it, please do comment, like, share. Subscribe to my YouTube channel and select the bell icon, which notifies you as and when I upload new videos. And similarly, if you're watching on Facebook or Instagram, do follow, comment, share, like. Hopefully I'll upload some more videos in the next few days. I hope everyone who's watching, I know I've got a bit of an international audience around the world. I hope the situation where you all are is good and you're all keeping safe. Unfortunately, in the UK, I'm based in a city called Leicester. Leicester is actually on the map now. Our local football team won the Premier League football tournament a few years ago. Prior to that, not many people knew or heard of Leicester. We've had to go down on a second lockdown. The infection rate here has exponentially increased over the last fortnight or so. So if you are from Leicester and you are watching this video, please do the right thing, follow the rules and guidance in place, keep yourself, your family and others in the community safe. Follow all the social distancing rules that the government have published for us. It's quite simple to follow. And yeah, just keep well and safe, and I'll speak to you all soon. Thank you. Bye.